Welcome back to From Girl to Great. My guest today is Hannah Mann, co-founder of multi-award-winning business Day One Strategy. Hannah herself was the winner of the UK Women in Business Award in 2024. I had the privilege of working with Day One Strategy in the summer of 2024. Hannah brings 23 years of experience in pharmaceutical market research and insights. Having worked in both the clinical and agency sides of the industry, she's collaborated with some of the world's largest pharmaceutical brands, supporting them from early stage development through launching and beyond. In 2019, Hannah and her co-founder Abigail Stewart launched Day One Strategy with a mission to bring together technology and human intelligence in the healthcare sector. Hi Hannah, thank you so much for joining me. How are you?
I'm well, thank you. Thank you very much for that introduction. It's a real pleasure to be here.
So I was wondering if you could give the listeners a bit of an insight into your company, Day One Strategy.
Sure. So we are a healthcare market insights business and strategy business. So people think, what on earth is that? And I think in its simplest terms, we do market research, but our clients are big pharmaceutical companies and the people that we talk to are their customers. So usually doctors, but also patients. And what we do is we talk to them. So we do interviews, like we might have a conversation like this with them. We might do a survey to collect data. And we try and understand what it is that they need, how they're treating their patients. So we can then tell our clients, the pharmaceutical companies, and they can make sure that the products they develop, the services and the drugs are aligned with the market needs.
It seems like a really important business. How did you identify a market gap and knowing that it was worth building a business around this?
Yeah. So Abigail and I worked together since we were in our 20s, early 20s. We had essentially built a business for someone else. We got to the point where we were like, actually, why have we done this for someone else? We should actually start our own business. And also, we just always wanted to have our own company. We had that ambition. But the reason why we did it when we did is that we spotted an opportunity in the market. So we could see that the world of market insight, research and strategy was changing. And we thought we could stay where we were. We had great jobs, well paid, but it's quite difficult to make fundamental changes to a very established business. So we thought, you know what, we're just going to go out alone, strike out alone, set up our own company and change things right from the start, which is why we called ourselves Day One. So we wanted to start every day like it was our first, always thinking about how can we do things better and looking at the new technology that's out, how can that help us in terms of finding new insights or working faster, whatever that might be. We were told that because we work in healthcare and pharmaceuticals, that it was impossible. The barriers to entry were too high. So that obviously gave us even more sort of impetus to spread everybody wrong. 6 years later, we're still here and we're very glad that we did make that choice.
I love that. So I know you also have the AI navigator and a lot of AI in your business. What's the relevance to that to your business?
So AI is everywhere at the moment, isn't it? And it has been for the last 2.5 years, really. And any business really should be thinking about how they use AI to either improve efficiencies internally and to productize using AI for their customers or clients. So that's exactly what we're doing. We manage and generate a lot of data for our clients, as you can imagine. Hundreds of interviews, hundreds of survey outputs. And so for us, using AI is really key to helping us manage that data, analyze it at scale. So we can train the AI to do that. So for us, it enables us to do our job better and faster than we could before. And also, as I say, using AI internally to make our systems more efficient as well.
Great. And in terms of setting up your business initially, you've mentioned you were told there would be very high barriers to entry. How did you overcome that in the initial days of your company?
I think with bloody mindedness, really, in all honesty. We were probably a bit naive to some of the barriers, which I think is a good thing, because it's not easy. We looked at what the market needed. We went to clients, we got feedback, we pivoted and changed when we've needed to. And we brought in really great people within the business to help us with areas of expertise that we don't have. So compliance, data security, all those kinds of things. If you know what you're doing, you're determined and you really want it, you can overcome those barriers.
Thank you. I know you have a UK base and a US base for your company. How does your business operate differently between the UK and the US with the different healthcare systems?
Well, yes, the US is very, very different to the UK in terms of healthcare systems. There's only 2 countries in the whole world where you can advertise drugs directly to patients, and America is one of them. So it's a very different landscape. Culturally, it's very different in terms of how people feel about even taking treatment. I think in America, they're more open to taking treatments. In Europe, we tend to actually not want to be medicalised. And also things like access to drugs, the barriers to drug access are different across the UK and the US. So there are lots of differences. But I think fundamentally for what we do, it's all about understanding human behaviour, what drives people to do certain things, what drives doctors to make the decisions that they make, what drives patients to take treatment, not take treatment, and live the lifestyles that they do. And fundamentally, that is no different whether you're in the UK or the US. So the techniques and the approaches we use are quite similar, but we just have to be cognizant of the environment and the context in which we're working and how those external factors might be influencing the choices and behaviours of our clients' customers.
So are the clients separate in the UK and the US?
Yeah, so we have a team in the US. But if we have clients that are based in the US, they will work with them. If we have clients that are based in Europe, then our European team will work with them. And these brands are global, right? So actually the teams tend to have someone in the US, you have someone in Europe. So really, you just have to be flexible to work with wherever your clients are. And actually the teams, sometimes it might be that we just put the right people in front of the clients, so the right expertise, the right therapy area knowledge or whatever it might be. And that's how we sort of work things out. We try and keep it sort of US clients to the US, European clients to Europe, but it doesn't all kind of work out like that in this sort of global economy that we live in.
We hear a lot about challenges and underrepresentation of women in tech and entrepreneurship. Can you share any insights about how you've been affected by this in any situations on how to overcome those sometimes invisible barriers?
Yeah, so I've been quite lucky in my career in that market research is very female. The only thing is that when you tend to get to the top, so like the C-suite, so your CFO, CEO, it does tend to suddenly be, there are more men that suddenly appear from nowhere. So there is still a challenge there. I was at a conference literally this week, and I also had a report sent to me this week by HSBC looking specifically at women in business and women that are looking for funding, looking to be non-execs on boards. And actually some of the stats that were talked about at that conference and in this report are still quite shocking, really. And I was a bit, again, naive to it. I didn't really realise that there are more challenges probably to come for us that we haven't even thought about. So, for example, the HSBC report was called Women's Business Growth Initiative Report, and it was titled Fearless and Thriving, How Midlife Female Entrepreneurs Are Changing the Game. Very snappy. But within that, it said that only 2% of VC funding goes to female founders. So 2%. Only 18% goes to mixed gender teams. So you've got a man and a woman asking for funding. And all the rest goes to men. So 2%.
It's crazy.
It's like a tiny amount. So the odds really are stacked against you if you're looking for investment in your business. And that's just because you're female. And then also if you look at things like the number of angel investors, so only 14% of angel investors, so these are people that give you money to help you grow your business for a slice of your equity. There are only 14% of women, and again, all the rest are men. And whilst I think my experience has been quite positive to date in terms of being female, I haven't felt a lot of inequality. I think there are, as I say, still a lot of challenges to come, and particularly for women who are in businesses where they want to grow and they want investment. It gets even worse if you are in tech or in specifically AI. The odds for a female getting investment are even lower.
I think we probably need more women at being able to invest as well, like investing in these companies.
Absolutely, yeah. So I think there are companies now that are developing investment funds specifically for female-run businesses. So that they are trying to create change. So HSBC has a £250 million fund. And the company that I was with this week, so they're called BGF, they also have a female fund. So I think they are recognising that it's a bit of untapped potential. And actually the stats say that female-run businesses actually outperform male-run businesses. So it's not that they don't do well. So hopefully it will change over time.
Yeah. People need to listen to that stat more. And why do you think it's important to have women building the businesses that shape the future of AI in healthcare?
I think it's important because if they're not at the forefront of this change, then they're going to get left behind. And again, I have read reports that have said that the jobs most likely to be removed by AI are more likely to be jobs that women often do, and perhaps more clerical work, secretarial work, those kinds of roles, which maybe traditionally have been more female. So really, if women want to not get left behind, then they need to be sort of leading the way or at least trying to stay up with this sort of changing trend. So understanding what AI can do for them, skilling up, reading about it. And yes, if more women can create businesses with technology and AI, then even better, because they will hopefully then employ more women and the cycle will then change.
What advice would you give to your 17-year-old self if you could go back in time?
That's a good question. I would say be more confident. Again, as female, women tend to be sort of underestimate their own abilities, I think, and perhaps we don't give ourselves credit when it's due. So I think I would say be more confident, ask for what you want. And I've always been very ambitious, but actually when I look back, I think maybe I stayed too long in certain jobs and I should have moved. So I would probably advise myself to move around a bit more, work with different types of people, different companies to broaden my expertise. But having said that, actually my career has turned out well and I'm very happy. So all in all, it's been good.
And would that advice change if you were speaking to young girls now, like advice for them for the future?
I think that would stay the same. So I have a 16-year-old daughter, so I can think about her when I'm answering this question. And I would say to her, like, believe in yourself, be confident, go for what you want. But I would also say to youngsters today, the career path that you can take is very different from the one that perhaps I took and my peers. If you're lucky, you could go to uni and you get a graduate job and then you stick with it. You work really hard and that's it, right? Whereas now, I do think that youngsters should think twice about going to university. I don't think it's a necessity now. I think you can have a career without. It's a lot of debt that goes with university, so it's not going to be right for everybody. So I think you also might have a less linear career. I think you might zigzag backwards and forwards, try different things until you settle on what you like. Also, you can start your own businesses. You can set up a shop in 5 minutes on the internet and start selling things. So be entrepreneurial. If you are that sort of person, then go for it. Maybe get a couple of years at a company under your belt first to learn a few things. Maybe start at a really small startup, get close to the founders, learn as much as you can, and then make your choices. That's what I would say.
What impact does your work at Day One Strategy have on healthcare outcomes?
Oh, that's a good question. And it is quite hard to measure that, because the work is quite far removed from the outcomes, which all we can hope is that the work we do helps our clients better understand what it's like to be a patient and to therefore help create the treatments that they need. I hope we do impact outputs, but I say it's quite hard to measure it, I think.
Yeah, you're definitely having impact.
I hope so. I certainly hope so, because I think that's the nice thing about working in healthcare is that you do feel like you are doing something worthwhile. And when I was younger, I worked for quite a few years in HIV, and it was at the time where it was really changing. So this was sort of in the noughties, and you know, I remember interviewing someone back then where they had first been diagnosed with HIV, and at a point they'd been told they had like 6 months to live. That was it. And they used to do these like workshops where they would go and they would print their own coffin, because they knew 100% they were going to die. Got diagnosed with HIV, you're going to die. And then there was a switch. They started giving people combination treatments, so more than one drug at a time. And it absolutely completely changed the landscape. And then people started living a very long time. And then by the time I was talking to him, this was like 8 years later. He said, I was told I had 6 months to live. Now, 8 years later, I'm still here. And now in those workshops, they don't paint their coffins anymore. They do upholstery and they do paintings, artwork and stuff. So that's quite nice to see. And I'm not saying that our research made that change, but we can see that change over time. And it is quite rare in a therapy area to see such radical and fast change, something which is so horrific to get. And yes, that's a good example of what we've seen and why it's good to work in healthcare.
Thank you so much.
Thank you very much.
That's a wrap on today's episode of From Girl to Great. Here are the top 3 things we learnt from our conversation with Hannah Mann. 1. Confidence and clarity can cut through barriers. Whether it's starting a business or stepping into male-dominated spaces, Hannah reminds us that self-belief and strategic thinking is a powerful combo. 2. AI is transforming healthcare insights, and companies like Day One Strategy are leading the way by combining human intelligence with technology to improve how pharmaceutical companies understand patient and doctor needs. 3. Women need a seat at the table. Especially in the future of AI in healthcare, Hannah has highlighted how important it is for women to lead, invest and innovate in order to shape a more inclusive future. If this episode inspired you, follow From Girl to Great wherever you get your podcasts and on Instagram, which is at from.girl.to.great, for more real conversations with women building a better future. Make sure to check out our website fromgirltogreat.com to find out about everything else our organisation is doing to empower young women to lead in healthcare. If you want to support what our organisation is doing, consider becoming an ambassador or partnering with From Girl to Great. Being an ambassador involves writing blog posts, interviewing healthcare professionals, attending From Girl to Great events, and more. And partnering with us can help expand your mission and ours, leading to better healthcare in the future. See you next time.